Residents in Leader have been without emergency services since last June. This has caused a considerable amount of stress in the community, but there is light at the end of the tunnel. 2 international doctors are in Leader and completing their certification to practice in the province. Beth Vachon, interim CEO for the Cypress Health region, says the recruitment efforts have paid off and they have secured a 3rd doctor to staff the hospital.
We're expecting actually a fully licensed physician who's already practicing in Canada, and he's accepted our letter of offer and will be joining us. He has to give a 3-month notice period to his current employer, so he will be joining us probably in January as well.
This doctor is currently working as a physician in Eastern Canada. Even with the 3 doctors in the community starting in the beginning of 2011, this doesn't guarantee residents will once again have full services. The town will have to wait for the other 2 doctors to be fully certified, and the estimated completion date depends on a few different factors. But as Vachon explains, they have one common focus.
The expectation is that as soon as we have our 3 physicians up and running, that we are reopening that hospital. So our goal will be to open it up as we can. We'll expand it as quickly as we can to whatever hours that means for us. But again, the goal is to have that hospital up and running 24 hours a day.
The hope is to have all the services restored by the spring of 2011. By that time, the hospital disruption will have been ongoing for close to a full year. Physician recruitment continues to be an issue nationwide, with rural areas being deeply affected by this problem. With that in mind, the region says once they're fully staffed, the plan is to switch gears and prevent this problem from showing up again.
We won't continue our recruitment efforts as such, but really our efforts need to be on retention. That's where we'd like to focus our efforts then at that point, is maintaining those physicians in the community and not having to recruit.
For the time being, residents will still have to rely on emergency room services from surrounding communities such as Swift Current and Maple Creek. Although the outpatient department in Leader will soon be offering extended hours of care. For Southwest TV News, I'm Kara Rapke.